Welcome to Point of View. I'm Grant Mangan. The earthquakes have taken a toll not just on the city's buildings. Divorce rates are up as stressed out couples find the pressure of the post-quake environment just too much to bear. Alcohol abuse figures are up and so are drug-related offences. Keeping an eye on the health and well-being of the region's residents is the Medical Officer of Health, Alistair Humphrey.
What is it that your role involves?
A Medical Officer of Health is a public health physician, so they have to be a qualified doctor with experience of the public health system in New Zealand, and they're designated by the Director General of Health in the ministry. Their role is to deal with population health matters, and particularly around legislative issues, so the Health Act, the Litter Act, the Rugby World Cup Act, all mention, among other acts, all mention the Medical Officer of Health. So there's specific legal powers that the Medical Officer of Health has. But we also deal generally with the population we work with. And in my case, along with Dr. Raymond Pink, we are the Medical Officers of Health for Canterbury.
So was the post-quake environment an easy time to be the Medical Officer of Health?
Well, it's certainly been a challenging time. They've been challenging for everybody in the community. But under a declared civil defence emergency, the Medical Officer of Health has a specific role and has specific powers under the Act that they can use and in some cases should use. So certainly the earthquake was an important time for public health in general. There were the public health unit, I think, responded very, very well, and that was one of the good things that happened, or the less than bad things, let us say, because there's not much good about an earthquake. But we didn't end up with any outbreaks of enteric disease afterwards, despite the fact that our drainage system was wrecked, that our drinking water system was wrecked, the power was out for days, the drinking water was out for weeks in some cases, and yet we monitored it very, very closely. We didn't have the kinds of outbreaks that many places in the world see after something like the earthquake we had. So yes, it's been hard work, it's been a challenge, and there are specific responsibilities that fall on the Medical Officer of Health during an emergency.
I'm really interested in that point about the fact that the sewage system and the water supply were damaged, as you say, for weeks in some instances, but there weren't any outbreaks of disease related to that. Why do you think we were successful in that case in avoiding those? Because that's, from what you're saying, that's a major achievement, isn't it?
It is. My view on this, and I've presented this actually at the World Health Organization and to other UN agencies who were very interested in how Christchurch did, is that we had put a lot of work in beforehand into what you might call water and sanitary health, particularly hand washing, boiling water, and communicating with the general public. Much of that happened initially in the run-up to what became swine flu, the H1N1 outbreak that we had, the epidemic that the world had. Here in Canterbury, we've been preparing for years for such an event, led admirably by Paul McCormick, who's a GP, who pulled everybody together, monthly meetings of civil defence, of the council, of the district health board, of the laboratories, ambulances, nurses. Month after month, he pulled everyone together. We discussed our planning. We brought in the media. They were part of the process rather than simply getting media releases. They actually were part of the planning process. And communicating to the public that around those specific issues around hand washing and so forth was one of the important parts of that. We had things like the Pandemic Roadshow, for example, which went around Christchurch and is now being used by the UN as a model example of how to get a message out to a community. That was one of the example of it. But also the communication between the different agencies was very important. And the messaging around knowing your neighbours, which we pushed very, very hard, is an important message that isn't always conveyed that well if you look in other parts of the world. For example, there are people in the US who are kind of known as survivalists who are waiting for Armageddon, and they tend to have a bunker and they've got thousands of cans of baked beans and probably an M16 rifle and all sorts of other things. We know that that is not the way a community survives a problem. And we know because we've seen what happened in New Orleans compared with what happened in Christchurch. The way a community survives is by working together. You can never remember everything. You might think you've got the best emergency kit, and you should have the best you can get, but there will always be something that happens where you need some help. So at the end of the day, one of the most important parts of being prepared is knowing your neighbours. And that was a message that we pushed very, very strongly. So when we came to the earthquake itself, the city was in dire straits. We knew the water supply was compromised. We were monitoring the water supply very closely, and we could see it was contaminated, as was expected, because there were breaks in the drinking water pipes that kind of were very close to the sewage pipes, so inevitably there was going to be cross-contamination. Our community boiled their water consistently for well over six weeks. They kept boiling the water. Now, most international literature, and it's been well researched the world over, shows that if a medical officer of health or a city council or anyone else puts out a boil water notice, everybody boils their water for the first few days. And then after a week they get bored with it and they think, oh, nothing's happened, and they stop doing it. And that's been researched thoroughly. 1 week is about as much as you get. Here in Christchurch we had over 6 weeks. What that did was it bought time for the council, with whom we were working closely, to get the chlorine pumped through the system to get rid of those germs and allow us then to drink water safely until we were able to fix all the pipes. So, and remember, everybody had, we're digging holes in our backyard to use as latrines. So, and without water, we had to be very careful, mindful of the fact that we had to keep our hands clean. So people were using Sterigel and all sorts of things. So it wasn't an easy thing for a community to do, and you have to prepare a community for that. And I think a lot of that preparation was through that run-up to the pandemic, but also it's collaboration between the different agencies. So I think Christchurch did fantastically well, and I think the world has recognised that, actually, because I've been to a number of international meetings where people were absolutely astounded that this little province managed to do so well with what in fact was one of the most damaging earthquakes the world's ever seen. What then happened as time went by was the anxiety of the earthquake waned, but the frustration with the process of recovery manifests itself in waiting for EQC to sort something out for you or your insurers. And that is, the recent surveys have shown that for many people, the earthquake was not ultimately the thing that caused them the most stress. It was the ongoing waiting for something to happen, or the difficulties with finding accommodation and that kind of thing.
Did that resilience extend across into sort of the mental health area as well? Because there have been anecdotal stories about the stress levels taking their toll in terms of alcohol abuse, drug abuse, depression, a whole raft of problems that sort of spiked in that post-earthquake period, and even been the suggestion that some of those are still ongoing. Is that what you've seen?
The response by the community from a mental health perspective, again, is well documented worldwide. There tends to be what is described as a heroic phase, where after an emergency, communities will, certain people in the community will take a leadership role, and actually there's this sense of kind of everybody pulls together. The problem then for a community is that the honeymoon is soon over and things get worse. And I think we saw that, and we still see that here in Christchurch. So the data is still being collected, so absolutely knowing exactly what happened is not, we still don't know for sure, but we do have some indication of what has happened. There have been surveys that have carried out, well-being surveys that have looked at how people coped and are continuing to cope or not with the aftermath of the earthquake. So what we saw was clearly the aftershocks themselves were very stressful for some people, but it wasn't manifest in admissions to our mental health facilities, with the exception that a few people who had pre-existing mental health conditions seemed to be, they seemed to have relapses because of the earthquake, but there were no new, if you like, there were no new diagnoses of people. What then happened as time went by was the anxiety of the earthquake waned, but the frustration with the process of recovery manifests itself in waiting for EQC to sort something out for you or in your insurers. And that is, the recent surveys have shown that for many people, the earthquake was not ultimately the thing that caused them the most stress. It was the ongoing waiting for something to happen, or the difficulties with finding accommodation and that kind of thing. So it is a useful lesson for us all that it doesn't end, even after the immediate threat of the earthquake ends. Everything else carries on, as so many of us know well. It is a stressful time, and that has been manifest in certainly GPs reporting that they're seeing more people who require perhaps sleeping tablets or that kind of thing, or they might see more domestic violence, or they might see or hear of domestic violence, or they might see more alcohol abuse. So as stress builds up, you tend to see that in communities, particularly those that get hardest hit. And it's understandable. You will see people crammed into garages who can't find accommodation, who are struggling because the price of accommodation has gone up, and it's difficult for people.
You referred to the housing accommodation crisis in Christchurch. Are the consequences of that purely financial, or are you concerned about other things?
First of all, crowding is an important cause of illness. If you look at pretty much anything, any of the infectious diseases, you will see that people who live in crowded houses, they get these illnesses more frequently. And some of them are quite serious. So meningococcal disease tends to be in those places where there are more people crowded together. If influenza comes through, obviously it's spread more quickly. So there's the infectious disease issue. But at the same time, there's the social issues associated with people living in very close proximity. There are stress levels get pushed up for people. There tends to be more domestic violence when families are forced together in very crowded conditions. So there's that. And also there's the long-term issue, which, as a parent and as talking to my colleagues at medical school, this was back in England, one of the things that I really remember quite well was a friend of mine at university who had grown up in a fairly poor area of Manchester. And he described how difficult it was for him living in a crowded house just trying to do his homework. Now, we know that education is very important, but I try to give my children some space so they can come home and they can do their study and all the rest of it. But there are many, many people living in an environment where being crowded together for them is the norm. And the thought that you might have 2 or 3 teenagers in the family who need their own space to sit down and actually get through their school, pass their exams, it passes invisibly sometimes. They struggle, but it's not understood that, hey, just give someone a quiet space and they can work. So there's the short term, there's the infectious diseases, mental health issues, and then there's more long-term issues that do have a fairly profound effect on a community if their children are having difficulty, for example, getting well educated.
So are the relevant authorities dealing with the housing accommodation crisis adequately, in your view, based on what you've said?
Well, we here at the Public Health Unit, we tend to focus on the specific health issues. So we don't look. We don't look at stock, how much housing stock have we got. We will make a comment about that, from time to time. And the cost of housing is important, but essentially we tend to focus on quality of houses, because a cold house, there's very good evidence that cold houses give rise particularly to respiratory illness, and we know that from looking at the data. But there are a number of others that also, cardiovascular disease tends to be higher in cold houses, along with a number of other things. Again, mental health issues as well. So we work very closely with the various agencies involved in housing to ensure that the quality of the houses is to a standard that means that the people living in them are not going to get sick. Now, it's an ongoing battle. I am not suggesting for a minute that it's over. It's never going to be over. We try and we work towards improving the quality of people's houses. And from a health perspective, we push quite hard. And health is important in all that, because the housing agencies will look at things. They will maybe consider stock, they may consider building codes and that kind of thing. But to have a medical person actually explain to them, if you don't improve the insulation in this house, you will see people who turn up to hospital, is something that doesn't always occur to them. They're not always immediately aware of that. So health is an important part of the team, along with all those other agencies around housing. The big issue is the chronic exposure, and all our data shows, and it matches up with international data, is it's people who are exposed to it for not hours and days, but weeks and months and years that are the ones that develop asbestos-related disease.
Asbestos has had quite a bit of publicity. There's been a lot of concern about asbestos in ceilings, for example. It's been enclosed, but it's not the only asbestos in the community. Obviously, there are asbestos roofs, asbestos walls, asbestos fences. How concerned should we actually be about all those other examples of asbestos in the community? My
concern initially was with the public health effects of asbestos. By and large, asbestos is an occupational health issue, and for most of the time, as a public health physician, I can say, well, that's the occupational health doctors, they deal with that, and we can leave it there. My concern around ceilings was that this was going to end up in the bedroom of a baby who was going to live there for 6 months, and that was very much a public health issue. That was not occupational health. I had to push very hard with MB, as they were called at the time, and indeed even with the Ministry of Health to get this issue recognised. But I'm very pleased to say that WorkSafe now have taken on board the issue of that specific issue, but also asbestos in general. And particularly, this city is effectively a giant building site at the moment. So in a sense, we're all living in an occupational work environment. Outside this office, there's diggers, just as everybody else has seen. All over the place there's stuff going on. Which the question then arises is how much asbestos is out in the community. And WorkSafe are carrying out surveys now of the whole city to find out what the background levels are compared with what we have here. It's not simple, because any city has a lot of asbestos in it. There's been studies done in Paris, for example. Brake linings of cars have asbestos. So, you have to find a comparator for Christchurch. You can't just measure it and say, oh, that looks high. You have to measure it against what is normal, and then work out the risk. So that's being carried out by WorkSafe, and we're involved in that. So, as we should be. So, pleased to say they're doing something.
I wonder though, is it too late? Because obviously the time when a lot of the asbestos roofs or asbestos in houses and things was being disturbed was in that immediate period after the quakes, where I'm going to assume, and I might be wrong in saying this, I'm going to assume that that's when most of the asbestos fibres would have been released and been free to kind of be blow around or be carried around the city. So, I mean, I'd almost be quite surprised if there was much ambient kind of asbestos, but who knows how much is actually kind of lying in the ground, ready for the diggers to kind of spread around again.
Exactly. There could well be quite a lot left lying around. And yes, I agree, things should have always happened quicker. I was pushing for this, 2 years ago. I had hoped it would be faster. I am pleased it is finally happening. And it really is a credit to WorkSafe. They've got the right people in who've taken the initiative. They happen to be Australian, where they're not New Zealanders leading this. The Australians have come over and said, we would never tolerate this in Australia. What are you doing over here? But you need those people sometimes. You need somebody who's seen a different perspective. So they've come in and they are changing it. The other thing to bear in mind is that asbestos-related disease is actually it's a chronic problem. An acute exposure, in other words, over a period of hours, days, exposure is not actually going to, the evidence suggests that's not the really big issue. The big issue is the chronic exposure. And all our data shows, and it matches up with international data, is it's people who are exposed to it for not days, not hours and days, but weeks and months and years that are the ones that develop asbestos-related disease. So sure, it should have happened earlier, but what we want to see is that we cap this problem quickly now. Let's make sure we deal with it, and hopefully that will deal with the problem for the community where there are high levels, if there are high levels, because we don't know for sure, but that's where we really want to look at it.
Should we be focusing, though, with asbestos on minimising future risk? Because, I mean, there are some streets in the inner city which you can drive down. If you look up at the roofs, you can see asbestos roof after asbestos roof on warehouses and industrial buildings and the like. Wouldn't now be a good time to actually have some kind of a strategy or plan to say, we've got to do something about these, rather than saying, okay, well, there's no problem with the air quality at the moment, so we won't worry about it until the next earthquake comes along and then have to go through this cycle again? Wouldn't a bit of prevention or preemptive kind of action be a good approach?
If you look at what they've done in Australia, many of the state governments in Australia have said, they've drawn a line in the sand. They've said, we will get rid of all asbestos in this state. Now, that is a massive undertaking and will probably take decades, but they have committed to it. They've not said we'll have it all done by 2020 or 2030, but they have at least said they will do it. I think that would be a great way for us to go in New Zealand, to say, we will do this. Not saying we'll do it tomorrow or next week or next year, but we will do this. This is what we will aim for. With the earthquake, it's given us an opportunity to remove the asbestos where it is deemed reasonable to do so. It is important that, given that no one has said they're going to get rid of all of it, it is important that where it is not causing harm, it is left alone and not messed around with. But given we've had an earthquake that, Mother Nature has messed around with it in many cases, we need to get rid of what we can right now, and that will be done. And WorkSafe, I think, are driving this process much better than has been driven before. They've run a number of sessions for tradesmen, which have been really well attended. Hundreds of people, hundreds of tradesmen turning up, looking at where the risks lie and what they can do about it. Getting rid of it, in most cases, is the preferable option.
That was the point of view of Alistair Humphrey, Medical Officer of Health for Canterbury. Until the next time, I'm Grant Mangan. Goodbye.